One. The next meeting of the Board of Health will be held on Friday, May 20th, 2022 at 8 a.m. in the Selectmen's Meeting Room at the Richard D. Carney Municipal Building, located at 100 Maple Avenue, Shrewsbury, Massachusetts, 01545, at which time and place the Board of Health will consider the following agenda. I'd like to call the meeting to order. And the first item on the agenda is the review and approval of the minutes from the April 15th, 2022 Board of Health meeting. Do I have a motion to approve?
So moved.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The meeting minutes are approved. The next item on the agenda is to review and discuss 17B Oakland Avenue. The property owner is seeking a 6 to 8 week extension beyond a 30-day order to correct letter due to supply chain issues and contractor scheduling. The recommendation is to grant an extension through June 17th, 2022. Mike, are you going to address this issue?
Sure, I can start addressing that. I believe I did a complaint inspection there, housing inspection, which came up with some issues. One of them was windows on the house and an exterior door that needed replacing. So I believe they fixed almost everything else on the list, and they were just waiting for windows to come in and obviously to schedule a contractor to get the replacement done. So they're making seems like a good faith effort to make the repairs. So I would definitely agree for an extension or support that.
Okay, so the work is basically window installation and some electrical work. Is that right?
I don't think there was a whole lot of electrical work, maybe an exterior outlet that still needed repairing.
Okay.
And then it mainly was just the windows and a door that were
Okay,
being
so the
replaced.
windows, the materials, and the contractor.
Yes.
At the time, okay. Is there anyone here that would like to address the issue, the owner or the tenant? Okay. I guess not. So any
My
question?
name is Jordan. I'm the tenant. I just want to clarify, it's a replacement of some window, a door, and there some upgrades that need to reinforce the structure of some stairs.
Yep, oh, the stairs, yep.
Okay. Any questions from the board?
We couldn't hear who called in.
That is the tenant. Is that the tenant, Jordan Brusso?
Yes.
Okay. Any further questions from the board?
No.
Okay, if that was going to be my question, Micah, that it seems like a good faith effort to get the contractor and the materials, so.
Yes, and we did just have their building permit. They have already submitted that and it was approved. So things are definitely moving forward.
Okay. In that case, then, do I have a motion to extend the issue to June 17th, 2022?
So moved.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The motion is passed, so the extension will be valid through June 17, 2022. Okay. The next item on the agenda is to review and discuss the emergency regulation requiring employers to report positive COVID-19 cases in the workplace in the town of Shrewsbury. Is Karen on the phone? Kerry?
Yes, hi, good morning, Mr. Chairman, I'm here.
Hi, Karen. Is it your recommendation to continue this item?
Yes, it is. Currently, the city of Worcester also has retained that requirement, and obviously with the uptick in COVID cases, it's just helpful for us to know, if people are having employees or multiple employees testing positive. It just gives us another tool just to be able to talk with folks and sort of think about, how to keep others safe, if there needs to be any cleaning, just being able to provide guidance. We're not out of the woods. I think everybody knows that. So I would just ask the board might consider just leaving it on maybe, through the summer at least, or we can revisit it because it's an important tool that we have for COVID right now.
Okay, thank you, Karen. Yeah, I would tend to agree. Under the current circumstances, it makes sense to me to continue this requirement to report positive cases to the Board of Health. Any further comment, questions from the board?
Agree.
I would agree too.
Okay, I think we could just leave it at that then.
Great.
Okay, the next item is to review and discuss coronavirus COVID-19 update. Karen?
Sure. And keeping with that theme, and certainly, Dr. Abraham can speak to this as well. We're watching, the numbers go up. We're in a surge. We are seeing both at St. Bees and at UMass hospitalizations increase. And we're not, I think you might know at this point that, for 2 years we did daily case counts. And then when the numbers started to recede somewhat, we went to a weekly report, which didn't line up exactly with this call, so I don't have that information. I won't until probably mid-morning. But we do have the Shrewsbury data dashboard, which is also on the city's website, so that gets sent every Friday. And we'll have that updated today as well, and we'll send that over as we've been doing. But the basic trend is that the numbers are high in New England, in particular, looking at the CDC website, which we've used multiple times just to look at sort of some indicators about where we are in the universe. Worcester County is still considered a high transmission county, which means that we're in red, which so is a number of other communities. So CDC has been recommending, as we have all along, that, if we're in, a high red category in particular, that we have always recommended that people wear masks. So that being said, sort of what happened last week when I was out on vacation is that Dr. Hirsch, who's our medical director for the city and the Alliance, he felt really strongly about issuing an advisory. So just to be clear, it's not a mask mandate like we had, but just an advisory, which quite frankly is just stating what we've already been saying, is the CDC as well, that, we're not out of the woods. We know the case numbers are going up everywhere and hospitalization rates are increasing. So essentially, Dr. Hirsch put out a letter, if you will, an advisory that Carolyn Jackson from St. Bees, as well as Dr. Dixon from UMass, co-signed with him, just basically saying, we're not out of the woods, we need to continue to be vigilant, and we're advising in this surge just and reminding people to wear a mask. So what the city did was issue that, and that really is a recommendation for the Alliance. So I've sent some communications about, sort of having conversations at the Board of Health level and the Alliance to think about if that's something that you want to consider. So that's kind of where we are today. It just worked out that you folks already had a meeting scheduled, so we thought we would just talk about it here. I would just ask Dr. Abraham if he has any comments as well about the variants and, what he's seeing at St. Bees and what his opinion is as an infectious disease doctor.
Great. Thank you, Mr. Chair. Thank you, Karen, again, for all your continued good work in this regard. So I echo everything you said. The trends are, so at least from both hospitals, there's a quadrupling of infections among hospital employees, so 400% increase among hospital employees. And about 40% of that is acquired from in the hospital, about 60% from the community. And I think what Karen stated, and which is the underreporting component of this, cannot be underscored enough, the fact that most home testing and people not testing at all if they have very mild symptoms is the reason why what we are reporting or what we get as prevalence is probably only the tip of the iceberg. The actual numbers may be higher. But that said and done, as we know, if we look at national trends across the country, the Northeast has a cluster, and we are currently in a surge, no doubt about it. But we also know that Europe is sort of about 4 or 5 weeks ahead of us. So as Europe numbers decrease, we should see the same trend head our way as well. So which means in the next 2 to 4 weeks, we should start seeing a decrease predictably unless there's any new variant of concern. So speaking of variants, the BA.2 is the current dominant variant. It's a little more aggressive in terms of the shorter time frame from the onset of infection to development of symptoms. But what we are seeing is essentially much milder symptoms, especially among all of us who are vaccinated, simply because that's what vaccines do. However, we know well that our current vaccines don't completely block against these variants, and that's why there is already new vaccines under trial right now, so that the hope is sometime in the fall that we might all be taking another version of the vaccine for the coming year. But in the interim, I couldn't agree more with Karen that we don't want to introduce another mandate right now, but I think given the prevalence of vaccination is higher than we were before our last Omicron surge, I think strongly encourage might be a way to just encourage residents to be mindful of the fact that don't trust on just the numbers that are reported, because there's always much more disease than is reported. And the fact that we are all vulnerable and our vaccines don't completely protect us against getting disease. They protect us against severe disease, hospitalizations, or death, which is a huge bonus, but therefore that at least a mask wherever they're in public, etc., would be responsible for all of us, protecting ourselves as well as protecting our fellow citizens when we are out and about. And again, if we are symptomatic in any way, considering testing, and sometimes it takes, so most people doing the home tests, it takes sometimes a day or 2 or 3 days for the test to turn positive. So sequentially testing on subsequent days would be useful in people who do only one test and say, oh, it's negative, so this must be allergies. But in reality, if you do sequential testing, sometimes that does turn out positive. So just increasing testing, isolating themselves if they are positive, just being responsible, and otherwise wearing a mask in public are all good public health measures that we would just strongly reinforce. But I'm also not a proponent of a mandate at this point in time.
Okay, thank you, Dr. Abraham. I guess the question I have, under the current situation, what is the relationship between the hospitalizations and the cases, say, compared to previous outbreaks or surges?
Excellent question. Lower for 2 reasons. One, the BA.2 variant is milder in terms of its severity of infection. Number 2, I think there's a greater prevalence of people who are vaccinated, and so therefore the number of hospitalizations are much lower. So hospitalizations and death are much lower, number of cases are much higher, reflecting the fact that we have milder disease plus more vaccinated people in the community.
Okay. Any questions?
Yeah, actually, I'm kind of curious. I know we had talked with Dr. Hirsch a while ago about research on long haulers syndrome. Excuse me, and I'm wondering if there's been any further research on that to look at sort of the prevalence of that in this area.
Yeah, excellent question. The NIH is conducting a large trial on long haulers, which is still in progress. They're recruiting patients. I've sent them folks from here who have had severe disease and are long haulers. So we don't have anything more in terms of information, but just for general interest about long haulers, and I think that's an excellent question. There was a recent New York Times article which actually looked at all the different areas of the body that are affected by even mild COVID, and was fascinating that even with the mildest of COVID, 85% of people have brain involvement, for example, which we don't recognize, but it is. So loss of smell, loss of taste are all evidence of brain involvement, etc. So just to show that I think the magnitude of disease, this is why we want to avoid disease at all costs, because what's unpredictable is what it will do to the human body, and each person could be very different, and what could be the long-term effects of that is also something which is still unknown at this point in time. So great question.
So, and I'm also curious about repetitive infection and the impact that has on the cardiovascular system.
excellent point. So we've seen people as early as 4 to 6 weeks after one illness to get another episode of COVID, reflective of, again, the fact that immunity is transient from disease, which is why we're still pushing people to get vaccinated. And effects on the cardiovascular system, absolutely, yes, including prothrombotic effects, which are well known. So the evidence of increased blood clotting, evidence of coronary artery disease, myocarditis, pericarditis in children, etc., are all well described. But I think virtually every organ system is susceptible to some effect or not. And I think over time, as we get to study it more, we'll probably understand the full magnitude of this disease.
Yeah, because I have concern for people that are getting repeatedly infected and the long-term impact that's going to have
No question.
on their systems.
Okay. So, Dr. Abraham, are you recommending that this board adopt, let's say, the advisory or recommendation that the City of Worcester put out in their letter?
Yeah, which is just to encourage people to mask whenever possible, etc. That, yes, exactly.
Okay.
I think there's a sample from Westboro too in our packet here.
Right.
Yep.
So is the board interested in adopting the Worcester letter then? That's,
Yes.
I would be fine with that. I'll make a
Okay.
motion to re-adopt that.
okay.
And has Dr. Hirsch had any conversation with the superintendent for Shrewsbury? Do we know, Karen?
No. Kristen did ask me when I had sent out an email about what the conversation may have been in Worcester with our superintendent, and the response was just to make masks available for graduation and prom. Again, not a mandate. So I, provided that information to Kristen, and obviously want to make sure we have clear communication to the community and to the schools about what this is and isn't. So it's just an advisory, which is already what we've been doing. And then I definitely would recommend for prom and graduation that they just make masks available. So if people want that, it's, that's there for them.
Mm-hmm.
So we would just communicate that. But I have not spoken to him, to Joe at this point.
Kristen Lotz, would you like to make a comment?
Sure, Chairman Vidgen. I did give Dr. Sawyer a heads up that the Board of Health would be discussing this matter today. He is aware of the Worcester advisory as well, and Ms. Freeman is here from the school department as well. So he is aware that the board would be meeting and potentially acting on an advisory at this time. But we do need to make sure we communicate clearly and effectively if this does go into effect.
Okay. So at this time, excuse me, yes, sir?
Does the public get to comment on anything in these meetings? I'm just curious. I've never been to one before.
It's not a public hearing, so if you have a very brief comment,
No, I'm just asking the question. It says public hearing on the notice, so I was just wondering.
I think it says public meeting, is that correct, Karen?
Public meeting?
Yeah,
Okay.
there's it's a difference. Public hearing, welcomes public comment. And we can accept some comment from the public if I allow it, but usually there isn't public comment unless there's a specific issue that we've prearranged to take comment on, so.
So typically, a resident would ask something in advance, and then there would be a hearing where the public would get to comment? Is that how it works?
Yeah, if there's an issue, for example, like tobacco regulations, then we would conduct a public hearing, or some other issue where we have prearranged comments from a proponent of some sort.
Okay. But I think that COVID affects, everybody in the community, and I think the public should have a say in it, so I just don't know how to go about that.
You could always send
Right. In writing.
send an email to the Board of Health.
Okay, thank you.
Okay, so at this time, do I have a motion to adopt the COVID-19 advisory that was put out by the City of Worcester?
Move.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. So the Worcester advisory is adopted, and again, please remember that this is not a mandate. This is just an advisory. It's purely voluntary, and it's just a recommendation from the board. Okay, the next item on the agenda is review and discuss the Central Mass Regional Public Health Alliance updates. Micah?
Sure. Not much out of the ordinary. We're in the process of starting to license pools and camps for the season, and always kind of a seasonal uptick in nuisance and housing complaints. So we are staying on top of that, and since the March meeting, we've done 138 inspections, and it kind of runs the gamut of septic, pools, complaints, everything like that. So that's all I've got for you.
Okay. Any further questions from the board?
Nope, not at this time.
No, looks good. Thank you, Micah. Appreciate that. Okay, the next item on the agenda is to review our meeting schedule, and I'd like to point out that Kerry is not going to be available on Friday, June 17th. So, does June 24th?
I was going to suggest June 24th as well. The earlier weeks, I'm unavailable as well.
Okay,
Yeah, I think that's fine.
okay, so as long as that's good with everybody, we will plan on the next meeting on June 14th, 2022. Okay, do I have a motion to adjourn?
So moved?
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The meeting is now adjourned. Thank you, everyone, for coming.
Thank you.